I have a story to tell. My name is Karen Wilson, and my beautiful mother, Victoria Berquist, passed away January 14th of 18 at the Fairview Long-Term Care Home at the age of 97 years old. I also have remained on the Resident and Family Council, long-term facility in Fairview, Alberta. You might say my mom had a good life, which she did, except from December 29th of 2018 to January 14th of 2018, when she passed away from her neglected care at the home. Please don't get me wrong. There are some very caring people and do what they can to help the residents. Mom's talent shone through her painting abilities, her love of family, music, and dancing, which her and I would do weekly. I will tell you how this breaks down as it follows. November 7th of 17 found Mom in distress, eyes glazed over, not speaking, teeth falling out of her mouth, and leaning to one side. Nurse had responded, took Mom's blood pressure. She had a pacemaker, so her blood pressure was always good. The nurse had responded some 20 minutes later and informed me that they would watch her, so I documented it. November 27th of 2017, I guess, missing her bottom teeth. Was not told till the 29th, and Grand Prairie was not phoned till December the 6th of 2017 to check the sheets, and was finally able to get her bottom teeth on December 21st, and I documented that. Bath response. If a man asked Mom for a bath, it was no. Mom was very aware of her dignity and what should have been done. It should have been noted on her care chart. We must remember our elderly are at home, not at a hospital. I documented it. Mom had been constipated for 11 days before I found out, and I feel Mom was neglected in care. This should have not happened if charting and reviewing clients' health conditions as they change. I was informed by the head administrator that Mom had refused her medication on January the 7th, 2018, and was not in her right frame of mind, and I was Mom's caregiver, so I documented that. We did not know Mom had osteoporosis. Mom had x-rays done 4 days before she passed away, and a locum told me besides her bowels were packed, and when they lifted her, they were breaking the bones in the bottom of her back. She screamed and screamed until we had to increase her morphine to give her comfort. I documented that. I did the proper steps in reporting. I documented the situations, talked to the administrator, wrote a letter to Alberta Health Services Patient Relations Department, wrote to the Honorable Sarah Hoffman. Sarah Hoffman sent the letter back to Alberta Health Services Patient Relations. So some of the concerns, we have short staff and shift schedules done in Leduc, Alberta. We have a telephone problem. Cell phones are used way too much in these facilities, and they're not caring for the people. Call bells are not being answered in a timely manner. Thank you very much.